Vermont's travel map, floating in a sea of red, is suspended. That means no one can visit without a quarantine. A lot of virus news to get to tonight. I'm Lauren Maloney. But first, State Health Commissioner Dr. Mark Levine joined UVM Medical Center President Dr. Stephen Loeffler and Burlington's mayor for a COVID-19 virtual town hall tonight. People had a lot of questions about the state's rising caseload and its impact on schools, travel, and more. Local 44's Devin Bates joins us live in the newsroom tonight with all of the details. A lot to discuss, Devin.
Yeah, Lauren, and it's not the first time these three have gathered for a town hall like this. Dr. Levine attributed this statewide spike in part to people spending less time outdoors as winter approaches, but he also said a lot of it is due to pandemic fatigue and people generally letting their guard down.
I cannot say this enough. To stop the spread, to protect each other, we need to act now.
Vermont Health Commissioner Dr. Mark Levine spent all of Tuesday delivering a public health message that's been consistent since March, but feels particularly urgent now as the region grapples with an influx of COVID-19 cases. The latest model shows a 34% increase in cases across the Northeast since last week. During the Q&A portion of Tuesday's town hall, someone said they noticed elementary schools have been getting more relaxed on social distancing in gym class and cafeterias, and wondered if they should return to phase 2 of the state's reopening plan.
We're not at that point yet, but I do understand where she's coming from. And though I've been sounding an alarm here in my opening comments, I don't want to sound an alarm so loud that we lose some of the ground we've gained. I think there are ways at the level of the Agency of Education and superintendents to make sure that all of the guidance that's been provided gets adhered to.
Similar questions have been asked about bars and restaurants, where outdoor seating has largely been halted as winter approaches. Mayor Moreau Weinberger said he considered ordering bars to return to an early closing time, but it isn't necessary right now.
I think the Vermont approach, really for months now, has been to try to be as surgical and direct with our interventions as possible, targeted at the areas that we are seeing problems.
Today, I said we had about 20 outbreaks and 60 situations we were following. I can candidly say that none of them are really related to bars or restaurants. People let their guards down so much more in familiar settings.
On the subject of familiar settings, Vermonters are wondering whether they should be inviting family over for Thanksgiving, and if they do, what precautions would be beneficial.
Our daughter and son-in-law, who live in New York City, want to come up for Thanksgiving. They're planning to get a quick response test before leaving New York. And I mean within the day before leaving. How safe is it for them? How safe is it for us and our community?
Testing on the day of travel is a great strategy for a lot of things, but it is not totally protective. You could still, within the window of time, which is a 14-day incubation period, test positive at any time during the next 14 days.
Now, Dr. Stephen Loeffler said there's currently 3 people hospitalized at UVM Medical Center, and the hospital has gone back to their springtime procedures, increasing their number of COVID beds and also setting aside some ICU beds for that purpose. Live in the newsroom tonight, Devin Bates, Local 44 News.